I can get your email or something at the end, we can work together.
Awesome. And we will be recording this, as it was mentioned in the big room, so you will need to approve that to remain in, and hopefully that's okay with everyone. It's 11:02. We'll give it till 11:03 to start on challenges. The break was good for me. I hope everyone else is feeling a little more energized after getting up and moving around. All right, it is 11:03, and in the interest of keeping to time and making sure that we cover everything today, I'm going to go ahead and get started here, and we'll let folks join as they come. We're going to follow the similar format to what we did earlier. So we're going to continue using Jamboard, and I'm going to be putting the link in the chat again if you don't have it anymore. So please follow that link, and if you're able, please go to slide 5 that will say challenges. We're going to be spending this session, or part of this session, discussing challenges related to professional development with training. So when you think of professional development, training, and education in physical activity, what challenges might you all be prepared to overcome? And again, I'm going to set a timer for about 2 minutes, and everyone can brainstorm, and then we'll start adding things to the Jamboard. But when you think of professional development, training, and education in physical activity, what challenges might you all be prepared to overcome? We have about 1 more minute. Please continue to brainstorm and think about ideas. Okay, so I see 4 up on the board, and I should share my screen probably. That would, or am I sharing my screen? Can you see my screen? Oh, I got all thrown off. I'll go ahead and share my screen. Sorry about that. So 4 challenges that we see: coordinating schedules of disparate groups, cost, time needed for training, determining the right curriculum, and someone has added cost, appropriate time, and location. Are any of these surprising?
No.
Was there anything? Oh, go ahead.
So I think maybe another challenge would be making sure that the content is something that's easily digestible by everyone, especially if we're doing more cross-sector trainings and collaboration. So not using like industry-specific lingo, use something that's just more straightforward.
Can you give a specific example of that, perhaps?
Yeah, so I work at the health department, and so a lot of our terms are very technical. We use a lot of abbreviations, especially when we're talking just interagency or with, DHSS, Department of Health and Senior Services. But when we're talking with, if I go in and I'm talking with a child care educator who might not have the same education background that I do, they might not be familiar with the terms and the acronyms. If I say PALS training, that doesn't tell anyone anything about what that training's about. But if I specifically state this is what it is, it's physical activities, learning sessions, and provide an overview of what that training is, it makes people a little bit more interested than if I say, yeah, we're doing a PALS training at the library, and we're going to talk about, social health indicators or something, making it something that's easier for people to understand across the board when we're wanting to get more people involved in it.
Absolutely. Thank you for that.
Yeah,
Someone who's also,
that's
Oh, go
funny
ahead.
you say that, because when I read PALS initially, I was thinking pediatric advanced life support, and I was really trying to figure out how that
Yeah.
applied to
Like,
physical
why is that
activity. But then
important?
when you explained it, it was obviously not the PALS I was thinking of. So
Right.
someone has added getting the leadership on board with the need for PA initiative, PD for their staff. So there was mentioned another challenge. Is there anything that's missing from this list? Is there anything that we're not seeing?
I think access. I know a lot of trainings have been moved to online. In my county, we're a pretty rural county. A lot of our residents don't have access to internet or reliable internet, so they wouldn't be able to participate in those trainings. So I think making sure that they are accessible and maybe offering a variety of different meeting types. So in-person, hybrid, online, maybe asynchronous. It's a little hard, but trying to consider other people's ability to access those trainings and education sessions.
Thank you. I see getting training approved in both states. So thinking of what's on the screen and what we might have discussed, are there any themes that you're seeing?
yeah, time and cost seem to be kind of jumping out there. But I think time goes with getting, time approved by leadership. Can we stop doing our jobs for so many hours, a year or a month or a quarter, or whatever it chooses to focus on the education part to get better at our jobs. But yeah, you got to have the authority buy-in for that.
Are there themes that might be missing from here that you've encountered in the work that you've done?
I mean, I know for us, we've done some things where we're trying to create some maybe videos for teachers and parents and kids to watch us, 10-minute little physical education videos. And that the part about coordinating the schedules of the people who we want to be involved is it gets a little tricky, especially when we're trying to get, high level kind of physical activity people like professional athletes involved to kind of promote it. Then there's all sorts of different factors that apply to who can do what and when, and do they cost anything? Is it a volunteer effort? Those kind of things have been difficult.
Thank you very much for that. Might there be anything else that is a missing challenge when thinking about professional development, training, and education in physical activity? Another way of asking this question might be, what might be getting in the way of making progress? What is a challenge to the challenge or a barrier to the challenge? This could be cross-sector. It could have to do with elected officials or funding. As wide as you can think, it would be good to collect that.
I mean, probably just inertia from not having done it before, creating a whole new thing out of whole cloth is always difficult. Kind of goes with motivation there.
Yeah, thank you, Sandra. I'll make sure that's noted.
I think it also is just bravery to approach legislators and explain the importance of why this is so important to the community. And maybe, we as OTs, we're so misunderstood. So when we go for our legislative day, a lot of times we just explain like, okay, so maybe, your niece or nephew has autism. This is how an OT would work with you on this. Maybe, and try to explain kind of ways that we would be able to benefit their family members or friends. And that if we can kind of do something like that, it kind of helps them understand the context in which we're trying to educate them. So I do feel like that's something that you gotta be bold and brave, confident in what you know what to do to approach people that can help move and shake things.
What else might get in the way of making progress? Is there anything? Oh, go ahead.
Yeah, I think stigma, because the way that, certain, words matter. And if we're saying things like obesity, and which, it is a very real condition, but I think making sure that we're not stigmatizing people who do have obesity, who have been diagnosed with obesity, so that they feel like they can engage in that as well. Making sure that we're not creating trauma around trying to get everyone on board with physical activity, because that can be an issue. Like, for example, like looking at Red Ribbon Week, things like saying winners don't do drugs, which insinuates anyone who does have a substance use disorder is a loser. So making sure that our messaging is safe and it's not causing harm, I think is a really big challenge that we need to really look at in that area.
Thank you for that. What other challenges might be there or barriers, specifically thinking cross-sector or working cross-sector?
I think that just us assuming that everybody knows what physical activity is, and I think that's just wording like what Andrew was saying. I think that's a big part of it is, we need to be able to have common language that we can all understand, instead of just assuming that people understand what's going on.
So to go back to themes and trends, we've discussed a couple other things now and some other potential barriers. Are there any other themes and trends that you might have noticed emerging in our conversation? I will say the one that jumps out for me was language and consistent language, if that resonates with anyone else.
Mhm.
Yeah, I think language is true, but I guess that's also part of the education component of it. If you're educating people on the right language to use, then everybody's on the same page there. So it's kind of a double-edged sword, you know, it's something that can be a barrier, but also kind of the point of the training.
Excellent, thank you. So we've talked about a lot today. We've kept it kind of centered in one area around professional development, training, and education related to physical activity. But I have to make sure that somebody is willing to share about all of that when we get back to the main room. Is there somebody that is kind enough to volunteer today to be the spokesperson for professional development? That responsibility doesn't extend past today, just for the next hour or so.
I'd be happy to talk about it.
Okay, thank you, James. Ooh, Joan, being inclusive starts with promoting access for all. I'm gonna take and copy that and paste it right in here. Thank you. So, thank you, James, and thank you, Joan. But in the chat or unmute, for those of you that are on the phone, feel free to unmute and just talk out loud, or use the chat if you feel more comfortable. Thinking of everything that we've shared today, and feel free to look through the Jamboard as you have it available, or if you need me to refresh you, I'd be happy to. What stands out to you? Was there anything today that stood out that you had not considered before? Is there anything surprising to you?
I don't think anything is terribly surprising, but I think we got some good themes on the, you know, opportunities, challenges, strengths, that especially if, you know, in our implementation groups and within the sectors we can work on.
Thank you, James. Is there anything that you know is missing, or anything that we haven't talked about so far that you came in today thinking, I wanted to talk about that?
I just wanted to say that I always valued all the team members that I knew, but I now it just grew in deep appreciation for everyone that's contributing to this discussion today, and that we all have something that we can bring to the table, and I feel like that's valuable as well.
Thank you very much, John. Those folks who are calling in, are there any thoughts that might be missing, surprising, or standing out to you?
I think just really engaging the whole community and kind of stepping outside of those silos. So instead of just focusing on partnering with you know, healthcare providers or people involved in like social services throughout a community, working on, you know, reaching out and engaging you know, everyone really, businesses, you know, NGOs, Parks and Rec, these places that we don't commonly think of working with, and making sure that we're inviting the whole community to this conversation. There's a lot of groups that people had talked about earlier on. There was a variety of different organizations, but making sure that we are engaging in the whole community and not just a certain sector.
Excellent. Thank you very much. Anyone else notice that anything might be missing?
I don't know if it's missing, but whenever I think of professional development, I think of reflection and personal growth. And I don't think that's something that I heard mentioned at all during this. And I know there's a lot of barriers within that in and of itself. Like, as much as, who has time to sit there and be like, oh, I need to do better. But sorry, I think somebody's trying to talk. I'll stop.
Thank you, Katie. Is there someone else that had unmuted and wanted to share? So we're going to go to one last Jamboard for the day, and it'll be on slide 6, and it should look like this. And I'm going to take a timer and I'm going to set it for 4 minutes. And I would like everyone to brainstorm their top 3 opportunities or priorities to focus efforts on moving forward, and put those top 3 on one sticky. Keep in mind, we're focusing on professional development, training, and education in physical activity. So while keeping that in mind, what 3 opportunities, priorities should efforts be focused on moving forward? And for those of you who are calling in, feel free to say it out loud later, and I'll make sure that it gets collected here. But I'm going to set a timer for 4 minutes, and please put those ideas on one sticky, your top 3. Just a little over 2 minutes left. Please take this time to reflect on what 3 opportunities or priorities the efforts should be focused on moving forward related to professional development, training, and education related to physical activity.
Sai, is there any way that you can move mine from the previous slide over, please?
Absolutely. If you'd be so kind as
Mine's pink. Bottom right.
Oh.
Yes, that one.
I've got you. Thank you.
Thank you.
I will figure out how to do that for you. I don't know right at the moment, but I'll sort that out. Thank you. About 30 seconds left. We can negotiate for more time if folks would like to take a little bit more time and reflect and brainstorm. I would like to see a sticky from every participant today, however. That would be very, very helpful. I see there's 7 folks in the room, and that includes me, so I'm looking for about 6 stickies here. Feel free to continue working on them, but we're going to begin going over them in the room unless somebody has a protest and says, I would love a minute more or 2 minutes more of quiet. I'm not hearing any protests. So I have time needed to educate, implementation group to develop training program, on-demand or online training approval for continuing education credit. I see collaborate with healthcare professionals to develop training, work with state agencies for approval for on-demand or remote training, and work with EC. Could you tell me what EC means, Rhonda?
I believe it's early childhood.
Perfect. Thank you very much. It's one of the downsides of not being a content expert in the room is I have to farm it out to everybody else. So thank you for that. Work with early childhood sector group to identify gaps. I have create an implementation group focused on developing professional development curriculum tailored for cross-sector groups, using common language in education, and 3, create. I have creating a toolkit for enhancing academic language and physical education, and intentional physical activity education showcasing a team-based approach. So as everyone continues to add their thoughts to this Jamboard, is there anything that jumps out as a theme or anything that jumps out as something that you think that's the ticket for me and I wish I would have thought about it?
It looks like getting a cross-sector group together to create some curriculum and education. It's kind of a little bit of a theme there, maybe.
Thank you. And
I would add that you can provide that in variety of ways, so make it in person or virtual or whatever, or on demand, make it a variety, of ways that they could access it.
excellent. Thank you both. Are there any other thoughts in the room or anything that might be missing up here?
I think maybe including a call to action when we're talking about like having these trainings or providing education, making sure that there is a call to action in there somewhere so that it provides kind of a means to actually utilize that information.
Would you mind expanding on that a little bit for me?
Yeah, so in trainings, I mean, a lot of times we are bombarding people with a lot of information at once. And kind of just summing up like what was the core point of this training and how what's a meaningful way that I can go out and utilize this information and put all that into practice. Because sometimes, I mean, you can provide a lot of information, but sometimes people need a little push on here's how you could utilize this, especially if we're talking engaging maybe with partners who aren't specifically focused on physical education. How can I put this into practice where I'm at in my community or with my job, what I do for work, things like that.
Thank you very much. Is there anything else that might be missing from here? Is there anything that you're thinking, I would really like to include this? I think this is an important priority or opportunity for us moving forward. And it can be as big as the world. We are brainstorming. The folks that have called in, is there anything that you're thinking that you'd like me to add to the Jamboard?
Yeah, I think my priorities were really like accessibility, making sure that the content's engaging and not so static, and using that, that common language. But I've noticed that's a big, can be a hindrance. But I think all those were pretty much on there.
Perfect. I will go ahead and share that on the screen. Could you expand on it being a hindrance?
Yeah, so with common language?
Mm-hmm.
Yeah, oh, absolutely. So I feel like if you can lose a lot of people, it can be really hard for certain people to follow along if they're not understanding the terms you're using. I've sat through training that weren't necessarily in my field, but were relevant to my job. And I did not know the lingo, and it made it really difficult for me to follow along and really take the information that I needed from it. So I think making sure that common language is used, or that if you are using certain industry-specific terms, you fully explain it so people know what you're talking about and can actually utilize the information you're giving them. If I use an acronym like, oh, you can contact DHSS for additional resources, if someone doesn't know what that is, that's not really helpful.
So it's the lack of common language is the hindrance, not the use of, like, if everyone shared it.
Yeah, it's the lack.
Okay.
Yeah, it's definitely the lack. Yeah, the lack of common language.
Yeah, the alphabet soup, so to speak, can be very, very difficult.
Absolutely. Yeah.
Well, and on that point, I think it's also important for us to all remember that ultimately we're going to have to distill this language down to a patient, to a family, to a kid who might have little to no knowledge of anything we're talking about. So we gotta definitely use the language that ultimately anyone can understand at any level. So it's got to be tailored to the group we're talking about, but then even more so to give them the opportunity to give that group the opportunity to pass that information on to, even third graders. So.
Yeah, oh, I agree. So, even expanding on it, like for people who are providing, the training, maybe making sure that we do develop our interpersonal skills and our communication skills so that we can break down some information too a little further. That can be tricky, especially if you're, communicating with young children and you haven't done that, or communicating with parents who might not have any clue what you're talking about. I think that's really important.
So in thinking about common language and thinking about professional development, where might priorities lie in professional development for working and developing better use of common language or ability to work across sector to explain things more clearly? Where might those opportunities and priorities lie?
I think part of that is developing whatever education we're doing with multiple different people. So not just the healthcare developing the curriculum and then passing it out to everybody else. That doesn't work because we don't have, we will start talking in code in healthcare. It just happens. So making sure when we are creating it that there are multiple stakeholders at the table.
Thank you. Does anyone else see an opportunity or a priority there?
I think just working on establishing and building relationships with the people that we're going to provide the education to. I think Andrea had a great point, that relationship is what's going to help drive people's willingness to and motivation to learn about new things.
And Joan, I want to call out something that you put in the chat specifically, and that's using the teaching and learning process where you start with asking what the audience already knows to better understand where to begin education, and specifically the phrase meeting people where they are at.
Mm-hmm.
So we have a little under 2 minutes left. Is there anything that we've covered today that didn't quite hit the mark that you would like to tag on or add at the end? Anything that you think needs to be heard in this room moving forward?
I guess I would say it's just going to be really important to find out who wants the education and how much of it they want.
Perfect, thank you. So we're going to begin transitioning back to the main session here in just a second. I want to thank you all for your time and for all of the effort that you put in today. I know this isn't always the most fun way to spend Thursday morning, so thank you for spending it with me and listening to me talk to you. Also, James, I appreciate you being so willing to talk in the big room. If you need me to share the Jamboard or anything, I'm happy to do that. Or if you just want to talk off the top of your head, you're welcome to do that also.
I still got the Jamboard up. I'll try to use it.
Perfect. And it looks like they're going to call us back. So thank you all for your time and all for your hard work.
Thank you.
Thank you.
Thank you.
Man, we were having a really good discussion. Then we got kicked back here. What?
I know Donald had the best comment of the whole day, and then
He
it was
did.
right in between. Yeah,
Dang it.
but solving all.
Yeah, that's how it works. Like I had the most enlightening thing going, and then whatever.
Well, let's see. I'm looking. Looks like everybody's back into the room now. So what we're going to do is do a share back to the entire group from each of the individual breakout sessions. So each group gets 2 minutes to share what you discussed. I know that is not nearly enough time, but that's all that we've got time today. There will be additional notes and reports coming out of this that'll be more encompassing, but this will just be kind of a little taste of what happened in the breakout rooms. So we'll start with access room number 1. And I think Jessica was the facilitator there. I don't know who's going to be speaking, but feel free to unmute yourself. And Jessica, if you're sharing a Jamboard or your screen, you can go ahead and do that now too.
Blake is sharing for our group. Blake, would you like me to share any particular screen on the Jamboard, or would you like to just share?
I think I can just share.
Okay.
So hello, everyone. My name is Blake. I'm with the Unified Government Public Health Department. So we talked about access to physical activity opportunities in our community. We had a pretty good group of people. We talked a lot about schools and also like early childhood development. We talked a little bit about engaging with our elected officials and just engaging the community to bring some of those safety concerns forward. At the end of our discussion, we did end up talking a lot about, or a bit about safety and perceived safety and actual safety, and really also talked about just creating a culture of physical activity. So we talked a little bit about how like our parks are built. Maybe there is like a baseball diamond or something like that, and you feel like you have to play baseball in order to be in that space. So really talking about how could we talk to our residents and talk to families about you can be physically active in many other ways, just out in your community, and just understanding that that will require some time in building trust and again, building kind of that culture of it's okay to be outside and maybe just ride your bike or walk around your neighborhood and do stuff like that. We also, those were the main things that we talked about. And we did talk a lot about local government. I think we had quite a few people in our group that was involved with that. And really just overall education and engaging with all groups of people. And just, yeah, those were our main points.
Great, thanks for that. Thanks for that summary, and it's interesting, and I think probably everyone is hopefully you're having the same experience I have, is that we were talking about policy, but some of those same issues came up in our group around community or communication and partnerships, and so as we're hearing these updates, let's kind of think back to some common themes around them all. Access to physical activity was by far the #1 interest area as people registered. So we actually had 2 access to physical activity groups. So the second group was led by, or was facilitated by Zane. And I don't know who's speaking from that group.
I'm going to share my screen and invite Jody. Yeah, Jody.
Okay.
Yeah. So we had a good amount of people from different from different sectors talking, and we definitely have some good collaborative work that we can move ahead with. We were talking about with Kansas City, we have a lot of opportunities because we do have some beautiful parks. We have some good bike lanes. We have a lot of sports teams in Kansas City and a lot of different activities that kids can get involved in. But we kind of had the same discussion, and we ended kind of in the same area with communication. Communication is hard to try to figure out what is accessible, what we have available, how our patients and family and friends can access these resources. So we kind of lumped our priorities into 2 different categories that can kind of be connected as one. So one of the priorities was creating the map of physical activity locations, gathering and distributing of program and resource information. So really this like side over here on the right, we really need to create our list, try to find our resources, talk with community health members and all the different wonderful organizations that you guys are involved in, and find that list, create maybe a central hub for that list where you can access it either in like a park facility or an online app or website, and then also how to communicate that out. So our other side of the priorities was communication. So talking with our leaders, getting feedback from Kansas City members as well to try to figure out how we can engage Kansas City into this priority as well, and then connecting the 2. So how do we connect both of these to get the word out there?
Great. Awesome. Thanks, Jody, for that update. Let's see, policy was next. So Julianne was the facilitator, and Allison is going to give us a summary.
Yes. Thank you, Allison. Would you like me to share the screen, or are you good to go?
Share it. Share
All
on.
right.
The notes are
I will
beautiful.
share it.
A lot of good work into those.
Okay.
So crazy, Jody, you mentioned all that because we talked a lot about that. Just the Wellness Hub didn't come up. So messaging and communication, getting the word out there, and then also duplicate groups. We also talked about missing the people who need to be at the table to make those changes and just understanding what they actually want. We also talked about trying to get some of those city officials out there to also help us out in the decision makers and convincing them. We also talked about how different languages, back to communication, maybe some of the city officials are not speaking the same language as the community members that are actually requesting. And so they're misunderstanding what's happening. And then also not being aware of those resources. That was one of the other big things. It goes back to communication, is who in your agency is going to these meetings to learn about all these offerings, and then what are they doing with that information? Are they taking it back to their work group and sharing those resources with people who can actually utilize those and take action? Staffing and funding, and people actually being able to make the adequate time to follow through on some of these actions as well too. But a lot of it came to communication, messaging, and understanding. And then we also had one on, let's see if I can go find it. Policy. Policy is hard, guys. A lot of us are not policymakers. And so then when those do come out, all the legal jargon and all that, like might be missing the mark on some of that. And then we're also having struggles with restrictions to those policies and getting those city officials to get to the table to understand why some of those policies need to change, so that way we can provide access for all. Did I miss anything? Anyone else in our group? Donald,
you may have mentioned it, Allison, but emphasis on, a coordinating entity for all of these things, that crosses state lines, crosses county lines, et cetera. Thank you.
Yep. Donald, you had a really good one at the very end.
You mean okay, so.
Yes.
So I was just saying, I think Allison brought up a point about having, one group is doing one project, another group is doing another project. We don't want to double dip. So it'd be great if there was a huge text group where we had all of our different partners on this text group. So when one sent out text, hey, I'm doing this project, someone else could be like, hey, I'm interested in that. I don't want to do it again. I'm hopping on, or something like that. That'd be awesome. I think that'd be awesome for all of us.
Yes, just sharing the wheels that you work so hard to create, so that way someone else can also duplicate that wheel and offer it in their area as well, in their community. So thank you, Donald.
Great. Next up, physical activity programming. That was Tina's group, or Tina facilitated.
I did. And I think, is it Chelsea? Are you sharing for us? And do you want to see the screen as well?
Yeah, you can show the priorities.
Okay, great.
So like all the other groups, we had a lot of the same conversations, even though we were programming, partnerships are key. In order to successfully do programming, we need to have the partners that are focusing solely on physical activity, the partners that are focusing on other health aspects, but, fitting physical activity into their work plans and the priorities is really key. And there's some great partnerships already. There's some great facilities with Parks and Recs. And obviously this physical activity summit has brought a lot of those people to the table, which is always a positive thing, and kind of breaking down those barriers for communication, which was another priority, is the communication piece. There's tons of great programming going on in the community, but sometimes the communication isn't widely distributed to everybody. There's a lot of different priorities in programming. So sometimes all that communication, if it's not your focus, it's lost. But finding the new and unique ways to get that communication out. We talked about newsletters and social media, and just the non-traditional ways as well. Another priority is, when you're talking about programming, is to meet people where they're at. It's great to have people come to a rec center, but if that rec center isn't accessible or that park isn't accessible for everyone, then sometimes that programming will fail. So really making sure that we're meeting people where they're at and to engaging the other businesses or organizations in that community. We talked about, you know, a grocery store that's a popular place, maybe a great partner to have, even though it's not physical activity, they can promote it. We can hold something at their grocery store that would promote physical activity. So all of those things, just inviting and inclusive and meeting different languages. We talked a lot about signage and how having different signages within parks or community facilities would be great. QR codes that take you to a different website or having signage in different language just makes programming accessible to all different types of audiences. And then beneficial, right? So meeting parents and kids all together, all different ages. And, you know, I think that's about the key things. And really, the last piece would be the innovative programming, thinking outside the traditional activity, walking, gym, really trying to come up with some innovative, engaging programming. COVID obviously has allowed people to become very comfortable with the online world and doing things virtually. So how can we kind of still capitalize on reaching audiences using that method, as well as having, you know, those central locations and parks and things that we can reach people at. So I think that's about it. And obviously there were several other conversations, but those were the key things we talked about for priorities for programming.
Great, thanks Chelsea for that update. And last group to share is professional development education. Sai was the facilitator there.
Yeah, and I think James was going to share for our group. James, would you like me to share my screen, or are you comfortable where you're at?
Yeah, if you want to share that kind of last slide, I think we can go over it from there. Yeah, so my name is Jay Robertson. I'm one of the sports medicine docs at Children's Mercy, and we're basically talking about different ways to educate amongst our groups and even down to families and kids. And what we kind of decided was that there's got to be some collaboration amongst the different sectors to really find out, make sure we're really educating the right people, the people who want the education, and making sure that we're tailoring the education to whatever group we're talking to. And as I've seen, communication and different language kind of becomes a theme in different ways, I think for all of our groups. But one of the things that we're really talking about is making sure that we aren't using jargon when we're talking to people, making sure we're using basic language that can educate everybody without people being confused or unsure of what acronym we're using and things like that. And that's something that needs to happen regardless of what group is being educated. But I think we've got within our whole KCPA plan a lot of highly educated and engaged folks who would be great resources to provide education. So I think that's where we've got some really good strengths in this group, and just making sure that when we do those implementation things that we do bring in the different sectors. Also, a big part of education is making sure people can actually get to it. So making sure that we give plenty of different opportunities, whether it be in person or online or on demand, kind of education that we can get everybody involved with. And obviously different parts of our states and different parts of the region have different access to those things. So we really want to make it accessible to all. It was a really big point that we wanted to make. And then another thing that we really wanted to make sure is that we could engage leaders in the organization. So in a business or in a school district or anything like that, to actually give people the time to do this and talk about costs and how to mitigate that for the individuals and maybe get it onto the group. So that's most of what we were talking about.
Great, thanks Jay. Thanks to all the groups for great summaries. Thanks to all the individuals for participating in the conversation. Obviously, that was just a snippet of what happened in all the breakout rooms. So we'll spend the coming days, weeks, and even months, really kind of better understanding what some of the themes and takeaways were from all of these breakout sessions. And that actually leads us to the end of the program and the next steps. Pull up my slide here. Sorry. So we've been recording all these sessions. We've been taking excellent notes. Of course, we have all the Jamboards from the individual presentations, and we're going to distribute all that information back to you, like I mentioned. We'll do that in several ways. One way is we do have a Kansas City Physical Activity Plan YouTube channel, and Katie might be throwing that in the chat if she hasn't already. This is where we have recordings of all those special events that we held in August and September, in addition to where we'll post some of the discussions that we had today. We also really try to prioritize communication through sectors that you've signed up for. So there are monthly sector newsletters that provide really good summaries of the things that we've talked about. And I'll show you in just a second on how to sign up for those sector updates and that communication in just a minute. And that brings me to, we hope that you join a sector working group. This is where the action of the Kansas City Physical Activity Plan really takes place, is at the sector level. And so the easiest way to be involved and to help with collaborative action across the plan is by getting involved in your sector work group. We'll show you on the next slide how to do that, but I strongly encourage you to sign up for one of those groups so you get those communications. Additionally, if you don't want to join the Kansas City Physical Activity Plan, if you don't want to join a sector work group, that's fine. This plan is a free plan. It's a publicly available plan. We would be ecstatic if we learned that some organization or some group all of a sudden went ahead and implemented strategies 24, 25, and 26 because they were part of some other working group from some other organization and were able to do it. That is what we want to do. Because if we get enough people implementing the plan, we feel we can make long-term changes in opportunities for physical activity in our region. So here are the upcoming sector work group meetings. So early childhood, healthcare, parks and recreation, sport, mass media and schools all have dates set. We have a couple other sectors that currently don't have meetings set, but will. But again, if you sign up for sectors, you'll get notified of when those future meetings happen. And again, Katie, I think, has put in the chat how you can sign up for those groups. And actually, it's on the screen right there too, Kansas City KCPhysicalActivityPlan.org/sector work groups. And with that, that concludes the 2022 Kansas City Physical Activity Summit. We're only 1 minute over. Thank you all for all of your work today. Thanks for joining the conversation, contributing to the conversation. We really appreciate it. And most of all, thank you for all you do for health in our region. And with that, I hope you enjoy the rest of your day and that we see you in a future sector work group meeting. Thanks, everyone. Have a good day. Oh, sorry, last one. I screwed up. Eval. This is the last slide. So we'll leave with this slide up. Please contribute. We do take your evaluations to heart. So please, if you have comments, not only about today's summit, but also the work in general, feel free to fill out this evaluation. And we look forward to hearing from you. Thank you.
Bye, everyone.